Hi everyone, and welcome back to the channel. If you're preparing for an interview as a certified nursing assistant CNA, you're in the right place. In today's video, I'll be going over some of the most common CNA interview questions and providing you with answers that will help you stand out. Whether you're new to healthcare or looking to refresh your interview skills, these tips will give you the confidence you need to succeed. Let's dive in and get you one step closer to landing that job. 1. Why did you choose to become a certified nursing assistant? I chose to become a certified nursing assistant because I have always had a strong passion for helping others and making a positive difference in their lives. From a young age, I was drawn to healthcare, and I realized that as a CNA, I could provide direct, hands-on care to patients, offering comfort and support during vulnerable times. I enjoy the personal connections I make with patients, and I find it incredibly rewarding to be part of their recovery and well-being. The role allows me to combine my compassion and dedication with the skills I've gained through training, making it the perfect fit for my strengths and career goals. 2. Can you describe your experience working with patients in a healthcare setting? In my previous role as a certified nursing assistant, I gained extensive experience working with patients in various healthcare settings, including hospitals and long-term care facilities. I have assisted patients with daily activities such as bathing, dressing, feeding, and mobility, ensuring their comfort and dignity at all times. I have worked with patients who have a range of conditions, including chronic illnesses, post-surgery recovery, and cognitive impairments such as dementia. In addition to providing personal care, I have supported nurses in monitoring vital signs, assisting with medical procedures, and documenting patient information. My role involved building rapport with patients and their families, offering emotional support, and ensuring that patients felt heard and respected during their care. Through this experience, I have developed strong communication, time management, and multitasking skills, which are essential when working in fast-paced healthcare environments. 3. How do you handle difficult or uncooperative patients? When handling difficult or uncooperative patients, I always approach the situation with patience, empathy, and active listening. First, I try to understand the root cause of the behavior, whether it's pain, fear, confusion, or frustration. I remain calm and provide reassurance, letting them know I'm there to help and ensuring they feel heard. If a patient is still uncooperative, I would calmly explain the importance of their care and how it benefits them, while also respecting their autonomy and preferences. If needed, I would involve other team members, like a nurse or physician, to ensure the patient's concerns are addressed appropriately. My main focus is maintaining a compassionate and respectful attitude, while ensuring patient safety and comfort. 4. How do you prioritize your tasks when taking care of multiple patients? When taking care of multiple patients, I prioritize tasks by assessing the urgency of each patient's needs. I start by focusing on any immediate or critical care requirements, such as administering medication, assisting with mobility, or addressing any safety concerns. After addressing urgent needs, I organize the remaining tasks based on each patient's condition and scheduled care. For example, I would ensure that patients who need help with personal hygiene or eating are assisted in a timely manner. I also make sure to regularly check on all patients to monitor their comfort and health status. Throughout the day, I stay organized by keeping a list of tasks and remain flexible to adapt to any changes in patient needs. Communication with the rest of the healthcare team is key, so I can ensure that all patients receive the best care and attention. 5. Can you explain a time when you had to deal with an emergency situation and how you handled it? There was a situation where I was assisting a patient who suddenly began to experience difficulty breathing. I immediately recognized the signs of respiratory distress and quickly alerted the nurse on duty. While waiting for the nurse, I ensured the patient was in a comfortable position, elevated their head, and made sure their airway was clear. I stayed calm and reassured the patient, which helped keep them as relaxed as possible. Once the nurse arrived, I provided them with all the necessary information about the patient's condition. The nurse was able to administer the required treatment promptly, and the patient stabilized. This experience reinforced the importance of remaining calm under pressure, communicating effectively with the team, and always being prepared to act quickly in emergency situations. 6. How do you ensure patient safety and comfort while providing personal care? To ensure patient safety and comfort while providing personal care, I always prioritize clear communication, attention to detail, and maintaining a respectful environment. First, I make sure the patient feels at ease by introducing myself, explaining what I'll be doing, and addressing any concerns they may have. I use proper body mechanics and techniques to prevent injury to both the patient and myself, ensuring their safety during activities such as transferring or assisting with mobility. I also make sure the patient's environment is safe by checking for hazards like wet floors or clutter that could lead to falls. I pay close attention to the patient's physical and emotional comfort throughout the process, checking in with them regularly to ensure they feel comfortable and respected. This includes being mindful of their dignity, maintaining privacy, and offering reassurance. Additionally, I stay alert for any changes in their condition, such as signs of discomfort, and report those to the appropriate healthcare team members right away. Lastly, I consistently follow healthcare protocols and policies to ensure the care provided is safe, effective, and appropriate for each individual patient. 7. How would you handle a situation where you notice a change in a patient's condition? If I notice a change in a patient's condition, my first step would be to assess the situation thoroughly. I would monitor the patient's vital signs, level of consciousness, and any other relevant symptoms to determine the severity of the change. I would document the observations carefully, making sure to include any specific changes in behavior, physical appearance, or complaints made by the patient. Next, I would immediately report the change to the nurse or physician in charge, providing them with the necessary information to help guide further action. If the change is urgent or requires immediate intervention, I would follow the established protocol for emergency situations and seek help quickly. Throughout the process, I would ensure the patient remains comfortable and calm, offering reassurance and support. My priority would be to act promptly, stay focused, and communicate effectively with the healthcare team to ensure the best possible outcome for the patient. 8. How do you handle stress and maintain professionalism in a fast-paced healthcare environment? In a fast-paced healthcare environment, I handle stress by staying organized and focused on the tasks at hand. I prioritize my responsibilities and break them down into manageable steps, ensuring that urgent tasks are addressed promptly while still maintaining attention to detail for less immediate needs. I also find it helpful to take short moments to pause and regroup when needed, as this helps me stay calm and clear-headed. To maintain professionalism, I ensure clear and respectful communication with my colleagues and patients, remain adaptable to changing situations, and focus on providing high-quality care. I also rely on teamwork and support from my colleagues, knowing that we can work together to manage the demands of the environment effectively. By staying positive, organized, and focused on patient care, I am able to manage stress and maintain a professional demeanor even in challenging situations. 9. Can you describe your experience working as part of a healthcare team? In my previous roles as a certified nursing assistant, I've had the opportunity to work closely with a diverse healthcare team, including nurses, doctors, and other CNAs. I understand the importance of clear communication and collaboration in providing the best care for patients. For example, when assisting with patient assessments or following care plans, I make sure to relay any changes in a patient's condition to the nurse or physician promptly. I also support other team members by helping with tasks such as mobility assistance or personal care, ensuring that everyone's workload is manageable. I believe in maintaining a positive and cooperative attitude, as it fosters an environment of trust and mutual respect, ultimately leading to better patient outcomes. Working as part of a team has taught me the value of teamwork, adaptability, and always putting the patient's needs first. 10. How do you ensure patient confidentiality and follow HIPAA guidelines in your work? To ensure patient confidentiality and follow HIPAA guidelines in my work, as a certified nursing assistant, I take several important steps. First, I always ensure that any personal health information is shared only with the appropriate individuals, such as healthcare professionals directly involved in the patient's care. I make sure to discuss sensitive information in private settings and never in public areas where unauthorized individuals may overhear. I also keep all patient records, both physical and electronic, secure. For physical records, I ensure they are stored in locked cabinets. And for electronic records, I use secure passwords and follow the proper login procedures to protect against unauthorized access. I am mindful of the importance of not leaving any patient information visible to unauthorized personnel or the public, whether it's in paper form or on a screen. Additionally, I stay updated on HIPAA regulations and the organization's policies to ensure I am fully compliant. I am also careful about what I say in informal settings, ensuring that I never share patient information outside of the work environment, whether in person or on social media. By following these guidelines, I help ensure patient privacy and maintain trust, which are essential to providing the highest standard of care. Do you have questions for us? Yes, I do have a few questions. I'd love to know more about the team dynamics and how CNAs work alongside other healthcare professionals, such as nurses and doctors, to ensure quality patient care. Could you also tell me about the training and development opportunities available for CNAs in your facility, especially if there are chances for career advancement? Lastly, what do you think are the key challenges CNAs face in your organization, and how does the team support one another in overcoming them? Thank you for allowing me the opportunity to ask these questions. That's a wrap for today's video on Certified Nursing Assistant Interview Questions and Answers. I hope these insights help you feel more prepared and confident for your interview. Remember, the key to success is being well prepared and staying true to your passion for helping others. Don't forget to like, subscribe, and hit the notification bell so you don't miss out on any future videos. Thanks so much for watching, and good luck with your interview. I'll see you in the next one.